My name is Katie Fenton and I'm one of the operational coordinators here at ACT, which means I manage teams of people that go out and do the frontline work. And I look after the children and young people services and also alcohol recovery. So the organisation covers lots of different services and areas. The two that I'm particularly involved in are the children and young people side of things and alcohol recovery. So we do a lot of frontline work working with very vulnerable people. I'm mainly in the office side of things, looking after the people that are doing that frontline work, but I also have sort of a lot of dealings with volunteers as well within the role, so quite a few of my services are volunteer led too. A lot of my work is managing the team that are out on the front line, so it's making sure that they're all right and that they know what they're doing with the people, but I suppose it's quite a lot of looking after the volunteers as well in terms of what work they're doing with the frontline service users as well. But day to day, I guess a lot of admin, so lots of filling in of forms and making sure that we've got all the appropriate information back here at headquarters so that we know what everybody's doing and getting up to. An awful lot of my services have volunteers who work with the young people. That can be really kind of light touch, just doing something fun once a month, right through to very intensive work to help support students in schools. So the volunteers do vary in what their interests are as much as what the young people's interests are, but we try really hard to match them together so that the volunteers and the young people work when they do meet and can really get some very good outcomes in terms of how they help support the young people that are out there. Well, our volunteer manager, Lisa, does all the recruitment for the volunteers, and as soon as anyone's sort of shown any interest through her team, then I'll tend to interview them, tell them a bit about the service and make sure that they're happy with what we're going to be doing, as well as finding out what their interests are, so again that we can match them with the appropriate person once they get started. I suppose because I look after two very different services, certainly in terms of alcohol recovery, there's some quite serious issues that we can be dealing with. There's a lot of people that are really struggling out there. We have quite a few street homeless that we work with, as well as people that are sort of very vulnerable in their day-to-day lives as well because of the drink and the drugs that they use. So that, that's quite tough in terms of how we can best support and empower them to move forwards, particularly if they're really entrenched in that behaviour. So that's probably some of the trickier parts. But because the other service I manage is the young people, on the other side of it, we can hopefully get in there early on and really help support them and put them on the right path, I suppose. I mean, day to day, you can get some really brilliant outcomes coming through. Just, this morning I was reading a report from someone that was working with a student and they were really putting them on the right path. They're actually attending lessons now, which they weren't doing before. I suppose you can see much longer term effects with some of the other client groups, particularly alcohol recovery. You don't get sort of very small wins every day. It's often, looking back over the last 3 months that you've been working with someone that you can really see a difference that we've made and managed to get them housed or into rehab programs as well. So those are the kind of bigger wins that we see, as well as the smaller day-to-day things. So Anglia Care Trust work with a range of different service users. We have housing, so we have houses that the organisation own and manage and provide housing for very vulnerable people, and we also manage other properties as well, which can provide support for people that have come from domestic abuse. There's a refuge, and also housing for supporting ex-offenders as well. In the other services, we've got a domestic abuse team who work with really, really vulnerable families, doing really intensive support as well as kind of ongoing support for the families there. There is a money advice team. We do mediation work for families that are having issues in education. called SEND mediation. Within the services for children and young people, we have a mentoring service which works with young people, provides them a mentor to work with them over a period of time, doing weekly positive activities. We have independent visiting, which is a volunteer-led service where a volunteer goes out with a young person once a month to do, again, a positive, fun activity with a role model that for children who are in care, so children who don't have particularly people within their life that aren't kind of paid to be there. They have lots of social workers, and even the foster parents are paid to be there, so we're the one person that can work with them that is doing it as a volunteer and doing something positive, someone that's just for them and not involved in the other services. We've got advocacy, which is providing a voice for young people, particularly those in care or that are in quite a vulnerable position if they're under child protection, and advocacy gives them a voice, so prevents decisions being made for children that could potentially be, as far as everyone else is concerned, in their best interest, but if they don't have their voice heard, they won't know that what they actually want is being listened to at some of those bigger professional meetings. I've got independent advice, which is a student support service. So again, volunteers will go out with the students and meet with them once a month to do, once a week in independent advice, and they do activities to look at how to best support them in school. So children who are quite vulnerable to not attend school or not achieve in school as much as they could, and they work with them to help set small goals that they can achieve, and hopefully stay in school and achieve what they should do. I mean, it's a really good skills base, so across the different services that we offer, we're a good close-knit team, so within the organisation itself there's often a lot of experience and knowledge that we can go to ask. So even if we're working with someone on one particular area, so, if we're working potentially with like alcoholics on the recovery service, there's often issues that they'll face in terms of housing as well as benefits, so then we can go and ask our housing team or money advice for further information. So it's really useful to be able to go to all of the different teams and be able to use their knowledge in terms of helping people, even if that they're just on a particular service. It doesn't mean that we can't then use that expertise from other people.